Hello students, welcome to readmedprep Academy channel. Today we are going to discuss about reproductive health part 3. In this we are going to discuss about sexually transmitted diseases and cervical cancer. What is sexually transmitted disease? It is otherwise called in short STD or venereal disease in short VD or reproductive tract infections RTI. They are all called sexually transmitted infections. Normally, sexually transmitted infections are transmitted from one person to another during intimate sexual contact with an infected partner. Some sexually transmitted infections like hepatitis B and HIV are transmitted sexually as well as by sharing of infusion needles, surgical instruments, etc. with the infected people. Blood transfusion with blood products or blood from infected mother to the baby, the infection can spread. The spread of infection from the infected mother to the baby is called transplacental infection. The most common methods of transmission of HIV and HBsAg are unprotected sex with an infected partner, sharing of needles with the infected person, transmission from infected mother to the fetus, and infection from the blood products. What is the normal age of incidence of sexually transmitted infections? People in the age of 15 to 24 years are commonly prone to this infection because they are reproductive active in that age. What are the different types of sexually transmitted infections? It can be classified based on the organisms like bacterial, viral, fungal, and protozoal. Let us discuss about bacterial sexually transmitted infection. The bacterial sexually transmitted infections are gonorrhea, syphilis, chancroid, chlamydiasis, and lymphogranuloma venereum. We are going to only discuss about these diseases in the bacterial sexually transmitted infections. The viral sexually transmitted infections are genital herpes, genital warts, hepatitis B, and HIV or AIDS. The protozoan sexually transmitted infection is trichomoniasis. The fungal sexually transmitted infection is candidiasis. Now first let us go to the bacterial sexually transmitted infection. Gonorrhea. What is the causative agent? Neisseria gonorrhoeae. The spellings are very important when you write in your exams. The incubation period for this organism is 2 to 5 days. What are the features of the organism? It's a gram-negative bacteria. It's an intracellular diplococci. It is non-motile. The size of the bacteria is 0.6 to 1 micrometer in diameter. The symptoms of gonorrhea. It affects the urethra, the rectum, and throat in both the sexes. In females, the cervix also get affected. There is pain and pus discharge from the genital tract. There is burning sensation during urination. It also causes conjunctivitis in neonates. Now, what are the symptoms of the female and the male? You can see in this slide. The abdominal pain or pain with intercourse in the females, vaginal discharge and bleeding. In the males, the urinary tract infection occurs, even the kidneys may get infected, burning sensation with urination, inflammation of the penis, swollen testicles, and discharge from the penis can occur. Now, let us go to the next disease, syphilis. What is the causative agent of the disease syphilis? Treponema pallidum. What is the incubation period? 10 to 90 days. How does the organism appear? The shape of the organism is twisted or spiral bacteria. Such bacteria is called spirochete. It's a gram-negative bacteria and it is motile. The size of bacteria is 6 to 15 micrometers long and 0.1 to 0.2 micrometers wide. This is how the bacteria appears under the microscope. What are the symptoms of syphilis? According to the stages of the disease, the syphilis is classified into primary stage, the secondary stage, the latent stage, and the tertiary stage. In the primary stage, what are the symptoms? There is a formation of painless ulcer on the external genitalia called the chancre. You can see in the diagram a chancre on the underside of the penis and a chancre in the female on the vulva. What are the symptoms in the secondary stage? There are skin lesions which are reddish brown, small, solid, flat, or raised skin sores. There are rashes and there are swollen joints, fever and hair loss. What are the symptoms in the tertiary stage? Here, there is appearance of chronic ulcers on the nose, lower legs, and the palate. This leads to perforation in the palate, loss of movement, mental disorder, visual impairment, heart problems. The pathologic lesion of the tertiary syphilis is gamma, which is a soft, non-cancerous growth. Here you can see that the gamma can occur in any of the organs of the body, like the liver, the bone, the heart, and the brain. We must understand the differences between the different stages of the syphilis. In primary stage, which is the 3 to 4 weeks after exposure, there is a painless chancre at the inoculation site. In secondary syphilis, that occurs 4 to 8 weeks after the appearance of the primary chancre. The features are rash and the small outgrowths called the condyloma lata. Systemic symptoms are present, which are common. In the latent syphilis, that normally two types, early latent syphilis and late latent syphilis. Early latent syphilis occurs less than 1 year after the infection, whereas late latent syphilis occurs more than 1 year after the infection. And normally the latent syphilis is asymptomatic. In tertiary syphilis, that occurs 1 to 10 years after the infection. What are the lesions that occur or features? The benign gummatous lesions occur in various organs. In the cardiovascular system, there will be aortitis, inflammation of the aorta, coronary arteritis, or the inflammation of the arteries that supply the heart. And the CNS symptoms, there is tabes dorsalis, where the posterior column is affected, and there is weakness of the muscles and paresis. Now we'll go to the next disease called chlamydiasis. What is the causative agent of chlamydiasis? Chlamydia trachomatis. What is the incubation period? 2 to 3 weeks or up to 6 weeks. What is the size of the chlamydia? Chlamydia exists in two types of bodies. One is called the elementary body, the other is called the reticulate body. The elementary body is 0.2 to 0.4 micrometers, whereas the reticulate body is around 1 micrometer. Here you can see the life cycle of chlamydia. The elementary body enters into the host cell. It gets transformed into a reticulate body, and multiplication of the reticulate body occurs within the cell, and this reticulate body is transformed into the elementary body. And after the lysis of the host cell, large number of elementary bodies are released which infects other new cells. So what are the symptoms in chlamydiasis, which is otherwise called trachoma? Trachoma affects the cells of the columnar epithelium in the urogenital tract, the respiratory tract, and the conjunctiva. In females, here you can see the depiction that the infection ascends from the vagina through the cervix into the uterus and into the fallopian tube. It can cause inflammation of the fallopian tube and swelling of the fallopian tubes, and there may be formation of lot of adhesions between the fallopian tube and the surrounding tissues. Here you can see the conjunctivitis caused by trachoma. Now we'll go to the next disease, lymphogranuloma venereum. The causative agent again is Chlamydia trachomatis. The incubation period is 2 to 3 weeks or up to 6 weeks. The symptoms are, it can affect the skin or the mucosal genital damage can occur. There is urethritis. There is inflammation of the inner part of the cervix called endocervicitis. Locally harmful ulcerations can occur, and there will be enlargement of the genital organs because of the blockage in the lymphatic tracts resulting in genital elephantiasis. Here you can see the enlargement of the lymph nodes in the inguinal region in the male and here in the female. Now let us discuss about the viral sexually transmitted infections. The genital herpes. The causative agent is herpes simplex virus. It is an RNA virus. What is the size? 155 to 240 nanometers. What is the incubation period? You must know that incubation period means the time duration from the entry of the organism into the body or the infection to the production of the symptoms. That is called the incubation period. In this, the incubation period is 2 to 21 days. The average is around 6 days. What are the symptoms? There are multiple vesicles that appear. These vesicles can fuse together to form sores around the vulva, vagina, and urethra in the females. Whereas in the males, it can occur on the penis. And there is pain during urination, bleeding between periods, swelling in the groin nodes. Here you can see how the vesicles appear with satellite lesions. The genital warts. What are genital warts? The causative agent is human papilloma virus, otherwise HPV. The size of HPV is 55 microns. The incubation period is 1 to 8 months. It is a DNA virus which is double-stranded. It is circular. Icosahedral nucleocapsid is present. It's a small size, around 45 to 55 nanometers. There is no envelope. What are the symptoms that occur in genital warts? There are hard outgrowths called warts or small tumor-like projections on the external genitalia, on the cervix and around the perianal region. Here you can see the genital warts which are found on the shaft of the penis in male and the vagina, vulva or cervix and around the anus in the female. Now what is hepatitis B? The causative agent of hepatitis B is a virus called hepatitis B virus. It is a DNA virus. The incubation period is around 30 to 80 days. The size of the hepatitis B virus is 42 nanometers. Here you can see that it has different antigens that cause the infection in the host, like the HBsAg antigen, HBcAg, the HBeAg. It contains the enzyme, the DNA polymerase. Hepatitis B virus is a most common cause of liver damage throughout the world. How is it transmitted? It is transmitted through sexual contact, sharing of needles, mother to child infection or transplacental infection, and oral utensils. The testing is done by the blood test. Now, hepatitis B symptoms: the abdominal pain, jaundice, that is yellowish color of the skin and the mucous membrane of the eye, the nausea and vomiting, swollen abdomen because of the cirrhosis of the liver, because of the accumulation of fluid within the abdomen, and there is itchy skin because of the increase in the bilirubin content in the blood, and there is weight loss. Hepatitis B symptoms, other symptoms like fatigue, fever, rashes can occur. The end stages, the liver cirrhosis can occur, going in for liver failure. Now we will discuss about the acquired immunodeficiency syndrome, which is caused by a virus called human immunodeficiency virus or HIV virus. It is a RNA virus belonging to the family retrovirus. The size of the virus is 120 nanometers. The incubation period is 2 to 6 weeks, even more than 10 years sometimes. And the structure of the human immunodeficiency virus, you can see it contains a glycoprotein coat, a lipid membrane, a RNA is present in the center surrounded by a capsid coat, and the matrix is seen, and the enzyme that is present in this virus is reverse transcriptase. What are the symptoms of AIDS? In this, you can see the lymph node swelling is present. The respiratory system, there is dry cough because of the pneumonia. There is sore throat. There is muscle pain and joint pains. Headache and difficulty in concentration can occur. The skin can show rashes, fever and night sweats. The digestive system can show nausea and vomiting and diarrhea. The nail changes can occur where there is thickening and curving of the nails. Weight loss and fatigue can be seen. A peculiar type of cancer that is related to AIDS infection is Kaposi sarcoma. You can see in this image. Fungal sexually transmitted infections. The candidiasis. The causative agent is Candida albicans. The size is 3 to 7 micrometers. The incubation period is not very specific to describe. Here you can see how a Candida appears under the microscope. The hyphae and pseudohyphae are seen. It produces blastospores and chlamydospores. Now, the Candida infection can cause symptoms like white colored lesions in the mouth, in the throat, in the intestinal tract and the vagina. Here you can see white colored lesions in the mouth, on the uvula and on the palate. That is called oral thrush. Here you can see the lesions on the vagina, which causes itching and soreness. Abdominal vaginal discharge, which is curdy white, and there is pain during urination. In males, the infection can cause balanitis, that is redness of the glans penis. There is blotchy rash and a thick lumpy discharge accumulates between the glans penis and the foreskin. Now we'll move on to protozoan sexually transmitted infections. Trichomoniasis is an infection caused by Trichomonas vaginalis. The incubation period is around 4 to 28 days. This is how the protozoa appears on the microscope. It has a flagella, undulating membrane, a nucleus and an axostyle. It is around 10 micrometer in size. It exists only as a trophozoite stage. It is pear-shaped, 15 to 18 micrometers. It is motile. There are 5 flagella with an undulating membrane. There is a small anterolateral cystostome and a nucleus. The axostyle protrudes outside. In trichomoniasis in females, it causes vaginitis or the inflammation of the vagina, where it produces the greenish, copious, yellow, foul-smelling vaginal discharge. There is itching and burning sensation. Trichomonas vaginalis in males, it causes urethritis and urethral discharge. It also causes epididymitis and prostatitis. What is the treatment of sexually transmitted infections? Infections caused by bacteria are treated with antibiotics. Infections caused by fungi are treated by antifungal agents. Infections caused by protozoa are treated by antiprotozoal agents. infections caused by parasites are treated by antiparasitic drugs. These treatments are very successful, whereas treatment of viral sexually transmitted infections can be only treated symptomatically. They can be controlled by antiviral medication, but does not completely eliminate the risk of transmission of sexually transmitted infection. How to prevent the sexually transmitted diseases? Avoid sex with unknown partner. Avoid having multiple partners. Use condoms when you have sex with an unknown partner. In case of doubt, consult a doctor for diagnosis and get complete treatment. Now let us move on to the second part, the cervical cancer. Cause of cervical cancer, it is considered that cervical cancer can be caused by a sexually transmitted virus called human papillomavirus or HPV. HPV may cause abnormal proliferation of the cervical cells or cervical dysplasia occurs. Here you can see a small cauliflower growth around the lips of the cervix. What are the clinical features of cervical cancer? There is pelvic pain, increased vaginal discharge, abnormal vaginal bleeding. All these warning signs are very important, particularly abnormal vaginal bleeding in a postmenopausal woman or in a reproductive age group, heavier and longer menstrual cycle. Discomfort while urinating or severe pain in the legs can also suspect this disease. What are the risk factors of cervical cancer? Low socioeconomic status, nutritional deficiency, genetic factors, viral factors like human papillomavirus and HIV, tobacco usage, high usage of oral contraceptives, poor personal hygiene, and having multiple sexual partners. How can we diagnose a cervical cancer? Pap smear, otherwise called Papanicola smear. A smear is taken with a swab from the cervix. It is stained and mounted on a slide and is examined for the malignant cells. Another test is the HPV test. It is more sensitive to cervical precancer condition, captures the known cancer-causing viruses. It's performed once in 5 years. The X-ray, CT scan, and MRI also help in the diagnosis of the presence of cervical cancer and spread inside the pelvis and to other organs. PET scan may also be used to determine the stage of the cancer. Here you can see how the lymph nodes have been affected by the cancer from the cervix. Now, what is the treatment of cervical cancer? The options of treatment are surgery, radiation therapy, and chemotherapy, or a combination of any of these. The choice of treatment of cervical cancer depends on the size of the tumor and the spread of the tumor. The treatment choice may also depend on whether the woman wishes to become pregnant someday. Cancer treatment often damages the healthy cells and tissues, so side effects are very common with anti-cancer therapy. Side effects may not be the same for each person, and they may change from one treatment session to the another. Now, what are the cervical cancer surgical methods? We can do a total hysterectomy, where only the uterus and the cervix are removed in the initial stages, or a total hysterectomy with salpingo-oophorectomy. This salpingo-oophorectomy means the removal of the fallopian tube and the ovary, maybe on one side or both sides. Or radical hysterectomy can be done where the fallopian tubes, the ovary, the cervix, and the uterus are removed. The incision can be a lower transverse incision or a vertical incision. Now, radiation therapy in cancer cervix. Radiation therapy may be external radiation or internal radiation devices are available. The radiation methods which are used as internal radiation devices is called brachytherapy, where the cesium radiation wires are kept inside the cervix and the uterus so that they release the radioactive material to affect the cancer cells. What is chemotherapy in cancer cervix? For the treatment of cervical cancer, chemotherapy is usually combined with radiation therapy. However, depending upon the type of the cancer, chemotherapy can also be used alone. Chemotherapy uses drugs to kill the cancer cells. They are cytotoxic medications that prevents the cancer cells from dividing and growing. The drugs of cervical cancer are usually given intravenously. Now, what are the methods of cancer screening? Modern screening techniques can detect even the precancerous changes in the cervix. Therefore, screening is recommended for women above the age of 30 years once in a year. Here you can see, according to the woman's age, how often a woman should have a pap test. Under 21 years old, no testing is required. Between 21 to 30 years, pap test is required every 3 years. Between 30 to 65 years, pap test every 3 years. or tap an HPV test every 5 years. 65 years or older, no testing is necessary. Now, how to prevent the cervical cancer? Regular checkups with the specialist doctor, HPV vaccination, and regular pap smear examination can be done. The vaccination of CS cervix can be done by the HPV vaccination. This is given to girls aged between 9 to 13 years before they become sexually active. What are the preventive methods for cancer cervix? Other methods like modification in lifestyle can help in preventing the cervical cancer, like healthy diet, avoiding usage of tobacco, preventing early marriages, practicing monogamy, regular exercise minimize the risk of cervical cancer. So in this lecture today, we have discussed about certain sexually transmitted diseases and cervical cancer. Thank you very much. Kindly subscribe, like, share and comment our channel Read MedPrep Academy. Log on to www.readmedprepacademy.com. Our Facebook ID is Read MedPrep Academy. Email is readmedprepacademy@gmail.com. Kindly post your questions in the comment box. We will reply your questions with appropriate answers. Thank you very much.